a lot of times when we look at physical and occupational therapy, we think of exercise. You're thinking, okay, well, I'm going to go in there and I can do those exercises on my own. But sometimes it's the preparedness of what should I do? And I always tell people the difference between a physical therapist and a personal trainer is we both know how to strengthen the body, but the physical therapist is skilled and has a background in pathology. And pathology meaning injury or an area of the body that is hurt. So if you really have to understand how to work with a hurt area of the body and understand the severity of that injury to know, should I push through this or should I avoid this? Should I strengthen in this manner even though it hurts, or should I avoid strengthening in that manner and do it a different way because I'm actually making it worse by trying this versus better? So I think the mental aspect of being prepared mentally and not going in, when you have a test, when you have a job that you're lining up for and it's a big deal, some of the unknown causes more anxiety and more anxiousness than the act itself or going into it itself. So working with someone that can kind of help you understand what you're going to be going through, what obstacles you've got right now, how we can minimize some of those obstacles, and how we can get you ready for that upcoming day so that you're not behind the 8 ball and that you're not feeling stressed out that you're not going to be ready for this or that you're going to be further behind. But Nonna, I really do think our hands-on skills is what differentiates us and our ability to put our hands on somebody to work on some tissue, whether it be soft tissue or whether it be just lightly working on stretching a joint or mobilizing a joint. Mobilizing is a term that's used for moving a joint in a way that helps it to do what we want it to do without the downside. So everybody knows that we can kind of take a shoulder and just like stretch and stretch and stretch, and in theory, it will move better. But if you take a shoulder that needs a rotator cuff repair or that needs a total shoulder replacement and you crank and crank and crank on it, it actually gets worse. The range of motion doesn't get better. It actually gets worse because you're inflaming it. And now whenever it's calming down, it's more tight than it was going into it. So it's that constant balance between knowing when to push and knowing when to back off, how to calm it, and how to strengthen it. And I think those are the things that really kind of set us apart. But those hands-on skills allow us to work on some of that soft tissue and to calm down that area and help you to feel better so that you can move better going into the surgery or going into whatever you need.